Hi, Mackenzie. Thank you for coming to the staff meeting today. We're going to be doing a little bit of critical incident analysis, which is a reflection technique that helps us to analyze and describe an experience or an incident that has happened in the clinical setting that has happened, and help us to understand what processes went right or what processes we could improve. So we have a scenario here that happened a couple of weeks ago in the emergency room where Mr. Smith, a 54-year-old male patient, came into the ER with complaints of fever, shortness of breath, cough, and chest pain. The ER was very busy at the time. The census was high and there were a lot of high acuity patients, and at the time that this particular patient came in, the ER tech entered the room with the patient and the triage nurse, and the ER tech prepped the patient for an exam, got him into a patient gown, put him on the monitor, and started an IV, all while the triage nurse was gathering information. When he started the IV, he went ahead and withdrew lab specimens, and he didn't want to interrupt the triage nurse, so he just put the labels on them and left the room and sent them to the lab. Well, about 45 minutes later, the ER doctor asked the primary care nurse that was taking care of Mr. Smith where the cardiac enzymes were and why they hadn't been drawn on this patient. Well, the nurse asked the ER tech if he had actually drawn these labs, and he said yes, he had, and he had walked them to the lab. And she called the lab. She discovered that the cardiac enzymes weren't run or even received on this patient. So the lab tech stated to her that she thought that there was kind of a weird order on another patient that was a 6-year-old female that was there for a simple cough, that there were cardiac enzymes ordered or to be run on her. Mm-hmm. So with the lab's help and further investigation, it was determined that the wrong patient's labels were applied to Mr. Smith's blood. So Mr. Smith was eventually diagnosed with a non-ST segment elevated MI because his cardiac enzymes were indeed found to be elevated. The lab error delayed his admission to the hospital, and the cardiology consult by several hours. So what were some of the things that you think were done right or correctly in this scenario?
Mr. Smith was brought promptly back to the ER for assessment and triage for his urgent complaint.
Yes, he was. Even though it was very busy and they had to shuffle patients around in order to make a bed for him, they brought him right back because he had an urgent complaint.
And the ER tech realized the urgency of the patient's complaint and immediately started an IV and withdrew labs.
Yes, the tech was right in there helping the triage nurse, got the IV started right away, which is important on a patient like this. What were some of the things that could have been done better in this scenario?
The ER tech should have verified the patient's name before labeling the lab specimens.
Absolutely. It only takes a second. He could have just said to the triage nurse, wait just a minute, Mr. Smith, can you give me your full name? And compare it to those labels. You're right.
The triage nurse could have also verified the correct label and patient's name.
Right. The ER tech isn't the only one responsible here. The triage nurse could have helped him out with that too.
And lastly, the lab could have called the nurse to verify that the correct labs were being performed on the right patient.
True. If the lab saw that there was a weird order on a patient, they could have called, and instead of just assuming that it was the right thing, they could have called the nurse and seen if that was the right thing to do. Joint Commission has implemented national patient safety goals in order for hospitals to be accredited. One of the goals is to improve the accuracy of patient identification. Wrong patient errors can occur at any time during the stages of diagnosis and treatment. One way to reduce errors when providing patient care is to use two patient identifiers. The reason for using two patient identifiers are to reliably identify the patient or the individual for whom the service or treatment is intended, and to match the service or treatment to the correct individual. So the patient identifiers we want to use in the ER or on the floor or wherever you are the patient's name and one other piece of identification, such as the date of birth or their medical record number. All lab specimens need to be labeled in the presence of the patients. So you simply, after you've drawn the blood or obtained whatever specimen you're going to collect, you have the patient simply state their name and their date of birth, and you compare it to the labels that you have there. You can also look at the patient's ID band that's on their arm and compare the medical record number. For patients that are nonverbal, say somebody that's had a stroke, or you have an infant or a child that can't relay that information for you, you can always confirm it with a family member that's at the bedside, or use the label that's on their armband. Additionally, only the staff member who collected the specimen should label the specimen. So I'm going to have you demonstrate for me how you would label this blood in the room.
Well, could you verify your name for me?
Sure. My name is Miss Mary Smith.
And your date of birth?
My date of birth is 09/13/73.
Okay, and it's correct on the label. And then I will label the specimen in front of you.
Okay, perfect. All right, well, thank you for showing me that you know how to do this, and hopefully we won't have any more incidences like this in the emergency room. We really need to educate every staff member who is responsible for labeling specimens, so that these errors don't occur in the future. Thank you.